We're continuing our education of breaking down how common therapeutics work. And for today's video, let's talk about Narcan, also known as Naloxone, which is a nasal administration given to an individual who is suffering an overdose due to opioid use. And the drug works to reverse the effects of that overdose. And it has its effects on the brain. And if we zoom in on the brain, we see that it has these things called opioid receptors, which are responsible for one's controlling their breathing and to control their consciousness. However, when opioids are used, they can bind to these receptors and one loses their ability to control their breathing or loses their ability to control their consciousness, placing them at extreme risk of death. So when Narcan is administered, Narcan has a higher affinity, or it's more attracted to the opioid receptors than opioids themselves. So it can move in and kick them out. And it can also stand there and block it from other opioids coming in and binding. Therefore, an individual regains their ability to breathe on their own and regains consciousness. Now, there are a variety of different programs in place across the US where lay individuals can get Narcan, such as at local health departments, at retail pharmacies, and even at community clinics or checking with one's primary care provider. So, to learn more about how different pharmaceuticals work, make sure to stay connected to my channel and with Dane Garvin.